All right. Good evening, everybody. Thanks for joining us on the call tonight. We have some good updates and a lot of activity to get to, so I'll get right into it. The first thing I want to do, Phil is unable to join us tonight because he is in Cuba. So I think he's on vacation or he is recruiting for the Detroit Tigers. I don't know, but he is in Cuba and won't be able to join us. So I'm going to make an announcement that I would have had him make, but just to announce, we wrapped up last year with all of our activity, and it will be the last year that we do the Pillars program because we're switching to a new Ambassador Action Center, which I'll talk about a little bit later. But I just want to recognize 3 people that reached 4 Pillars last year and thank them for all their hard work. Phil Moylanen was one of them. The other 2 were Jennifer Varner and CJ Heisler. So thanks to those 3 for reaching 4 Pillars, but also thanks to everybody because we had a lot of activity. It was recorded, and we had a lot of people reach multiple Pillars. So, which is great to see because it just shows how active and how much we're doing out there to try to move the agenda forward. But congratulations to Phil, CJ, and Jennifer for reaching the 4 Pillar mark last year. And we'll be sending them a certificate in the mail here next week. So thanks to that. The next thing I want to roll into, if Andrew is on the line, I'm going to kick it to him for a quick state update, although there's not a ton going on at the state. But Andrew, are you there? If I don't hear, I'm going to kick him to the end of the thing. So, okay. I will just move on then to that. The next thing on the agenda that I just want to talk about is kind of following up from what I've been sending out to you guys earlier in the week and last week after the training we had. And for those that weren't at the training, I guess, we had a very good training in East Lansing at the Breslin Center. We had 23 people there, I think, all very engaged. We went through a whole civics lesson of government, talked about all of our issues, federal and state priorities, and talked about advocating and what we want to do leaving the training. And we also ran through an exercise of passing a budget, which is always fun, I think. And hopefully, I think I've opened the eyes, or maybe everybody learned a little bit more about what we're dealing with and with what legislators do and what really impacts them. So that was a good time. But what we talked about a lot there was the Affordable Care Act and what is going on. Oh, yeah, Andrew's at a concert, I forgot, so he won't be joining us today. But the Affordable Care Act right now is the big hot issue, obviously, in the federal government. And we are expecting a timeline that would include the start of repealing the law somewhere in the next couple of weeks. We're a couple things coming out. First, we have the President's Day recess coming up that week of February 20th, I believe, where they will be out. But the following week, the President will be giving an address on the 28th to talk about health care. And we expect votes sometime soon after that on starting up what they call the budget reconciliation process. And not to get too technical in everything of how it works, because 1, it's very complicated, and 2, I'm not even completely clear on all of the ins and outs of what they need to do this. But basically what we need to know is that that's going to start the process of repealing it. And then comes the work of replacement. And that's where we're really focusing. And the good thing that's happened in the last month or so is that nobody's really talking about repeal anymore. It's kind of obvious they're going to repeal it. And most everybody's focused on replacement. And that's good because the media is focusing on it because it's very important what this replacement is going to look like. But Congress is also starting to focus on it because I think Congress has realized, and I think a lot of the Republicans knew this before, which is they got to come up with some decent replacement here or they're going to make a lot of people mad. And they're going to find themselves in the same boat President Obama did 8 years ago when he passed the law, except for they're going to be on the other end of it if they don't protect people. So that's where we come in, and that's what we've already been doing in targeted states around the nation. But now they're rolling it out that they want everybody this month to be kicking in and doing stuff. So we are laser focused on the protections and the key provisions in the law that have to do with cancer patients. And those, and I think pretty much most of you on the call are probably familiar with some of them, but just to go over just a review of kind of what we're talking about here, for those that don't remember the whole health care reform bill. One of the important things the ACA did is that it made all insurers cover what they called the essential health benefits. And those were 10 categories that covered everything from maternity care to emergency services to prescription drugs, covered all these main parts that made all prescription plan or all insurance plan had to cover. So it's going to be very important that whatever they come up with in a replacement, it requires insurers to cover those essential health benefits. Now, on the other end of it, what we're even more laser focused on is that we want any replacement they come up with to obviously address what's in current law for cancer patients, but either to do exactly what current law does or go beyond it. Anything that goes less than what they already do currently in law is obviously a regression for healthcare in this country. So we're going to be pushing that the prevention and early detection that's included in it is still covered. All those screenings that were covered at no cost sharing, we want to make sure that stays in. Funding for prevention and public health fund, which is very important. Our health departments get a ton of money in Michigan from that. We want that to stay in place. But then as far as private insurance goes, we're really laser focused on the 4 A's. And the 4 A's are something we did back when we were doing the health care reform debate 8 years ago, and it's back. And those are, we're focused on availability, affordability, adequacy, and making sure anything is administratively simple. So what does that mean? Availability means we got to maintain that no pre-existing medical conditions or restrictions to getting insurance. Plans can't rescind people. They can't cancel coverage when people get sick. And that coverage is available and continuous for people, and renewable coverage is guaranteed for folks. That's very important. Obviously, I think everyone in this call probably knows, for anybody that has cancer, if you have cancer as a pre-existing condition and they don't have to take you because it's a pre-existing condition, that's a big problem. If you get cancer and they can go ahead and kick you off for whatever reasons, that's a big problem. And obviously, if there's gaps in your coverage, or you get sick and they follow the policy through to the end of the year, and then they say they're not going to offer you coverage again, that's a major problem, obviously, because you may be still fighting your cancer. On the affordability side, more or less, we have subsidies, which are basically instant tax incentives or tax breaks for people that buy insurance on the healthcare exchanges. So we're going to have to make sure that we do everything to make that people can still have refundable tax credits to help offset their premiums. Otherwise, that's going to be a big problem. I'm going to give you one perfect example, which hits home to me. My parents are currently on the exchange. My brother is currently on the exchange. My parents pay a $700 premium a month. If they repeal Obamacare and do not add in any more subsidies or tax incentives or credits, my parents will go from $700 a month to $1,800 a month on their plan. That is a fact. That's what they've been told by their insurance company. If my brother goes off and there aren't any subsidies, he probably won't be able to afford a plan that he currently has. So you either have to get something far less or go with no coverage whatsoever. So these are the realities, I think, that are out there and what we're going to have to get across to Congress, that they need to make sure any replacement has included. Some of the other things, just with the affordability, right now we have a lot of limits on out-of-pocket spending for folks. I think that's going to remain very important. Obviously, we just went through the oral chemo battle where we were talking about this a lot, about if you don't have those maximum spending requirements on out-of-pocket costs, you're going to run into instances where people just can't afford their drugs. I mean, they're not going to be able to pay $3,000, $5,000, $10,000 a month for drugs. So that's going to be really important. On the adequacy side of it, we're really talking about the coverage limits. I mean, most important to us are probably the no lifetime and no annual coverage limits. Obviously, if you're healthy for a year, you're not have to worry about that. But in a year or a 2-year span in which you have to fight a cancer diagnosis, you could be talking about, a lot of money being spent out to cover that treatment. And so we have to make sure that that's covered, and that they don't hit you at some point and say you've hit your coverage limit in August, and now for 4 months you need to pay out of pocket for all your care, because almost every American won't be able to do that if they're fighting cancer. So that's going to be a huge part for us. And also under the adequacy kind of falls preventative health services with no cost sharing. And the making sure the essential health benefits are there. So those are important. Administrative simplicity is something we probably won't need to focus on too much, because a lot of the insurers are doing that right now. It's not something that's getting a lot of headlines either. So, but basically the ACA requires that people be able to get their policy, what's covered and what isn't, in layman's terms and easily explainable format. So that's important to us too. Medicare is affected in this somewhat. If you guys remember back to the donut hole in prescription drug coverage for Medicare, that's covered under the ACA, so that's going to be something that I'm sure seniors, along with ACS are going to fight for. But then, of course, on Medicaid expansion is something that we're also going to have to talk about. We have the benefit of being in Michigan, where our governor trumpeted, and that was one of his is probably his signature health accomplishment over his tenure, and he has already talked with senators and other governors and has been advocating for keeping Medicaid expansion. So, that's another part that we're going to be fighting for. But I just wanted to take some time to lay out those things that are kind of the key points and parts. I mean, there's a lot more to the Affordable Care Act that I could go into, but those are the ones that are of most importance. I'm pretty sure I sent everybody a fact sheet with some of these materials earlier in the week, and kind of gave you 2 or 3, I think, fact sheets that kind of lay out the gist of what we're really worried about or talking about are going to be most effective for us. So you have those materials with you as we start to go into some activity around this. But right now, I just want to pause and see if there's any questions about kind of those key provisions in the ACA and what we're trying to protect before I kind of go into the activities we're going to do for February. Any questions anybody has? All right. I know for those at the training, we talked and answered a lot of questions around this. So, and if you have other questions, you can obviously email me. And please look over those fact sheets. It'll be good to know what we're pushing for. So the next thing I just want to talk about is our activities. So ACS has declared February our Fight Back February month, where we are going to be pushing to get into these congressional offices and do a lot around that. So the one thing, the number one priority for us in Michigan and for you is what we really want to do is this month in February is we want to make sure we have at least one drop-off into every congressional office. I shouldn't say in every congressman's district, at least one in the month. So you don't have to, if they have multiple offices, you don't have to go into multiple offices. But we want to do a drop-by, at least one in each each congressional district. So I'll be asking each ACT lead to by the end of the month, take the time to drop in to one of the congressional district offices that you have in your district and drop off the materials I've provided you. I'll send those out again in a follow-up to this call, probably tomorrow or Monday, and drop off those materials and talk to their staff. I think this is something ACS CAN is doing. I think is going to be hugely important. Other groups are too. It's going to be important that people walk into these offices and talk to these staff face-to-face and say, any replacement has to be as good as the current law or better for cancer patients. I mean, and they need to do it sooner rather than later. This needs to be done immediately. We can't have a situation where people, this thing gets repealed and eventually people get kicked off their insurance and then there's a gap before something new. We can't wait 3 years, 2 years for something new. It has to be done now. And actually, what we would really like to see is them pass something along with a repeal vote so that it happens all at one time. We'll see if that happens. But that's our ask. That's what we'll be pushing out there. And I think, like I said, it's going to be really important we get in these offices in the next month to do that. Without pressure from the grassroots, I don't think we're going to basically get covered everything we want. And we're not the only group out there pushing for this. There's actually tons and tons and tons of groups out there pushing. And I think it takes the collective whole for us to get everything that's needed to make sure protections stay in place. So definitely put that on your to-do list to try and do a drop-off before the end of the month with the materials. Just so you know, I'm also going to be asking all of our ambassadors to do a drop-by congressional districts too, because we want to get multiple people in there dropping this off. And you know what? It's fine if they're dropping the same materials off that you're dropping off. It's fine if they're hearing it from multiple voices. We need them to. But at least with the ACT leads, if all of you put it on your to-do list, I'm assured that we know that at least one of our volunteers has gotten into each of the offices before the end of the month. And then any ambassador that stops into one of those offices is just an added voice that's just going to reinforce what we're talking about. One of the other things that we'll be doing too is I just today finally got the letters to the editor templates, so I'm going to be sending those out too. I want to get letters to the editor submitted in the next 2 weeks, as many as we can. It's going to be the same kind of thing as before. I'm going to send out the templates. I'll recommend everybody pick a letter that they like and personalize it and shoot it back to me in an email. And Tracy said she's more than willing to submit those to the newspapers on your behalf. So I'll send you the template. You send it back, customized, add a little your story, change it, make it sound how you want it. Send it back to me. We'll get your name and address on it and send it in. We'll include your phone number too, but all of those places we include the phone number because they just need it so that they can call you to confirm that it's your letter. They never print that. I think everybody on this call would know that, but just in case you didn't, that's what we submit, and then they hopefully will run some of these letters. Some of the targeted states have already had a lot of letters run because the issue's so hot. So I think if we can get a lot of submissions, we're going to see some of our letters printed. So that's another thing I'll be putting out to the ambassadors. But we have multiple template letters, so we'll be submitting them all so we can kind of track and make sure we don't get duplicate letters sent to the same newspaper from the same people. So we're going to be doing that. Those are probably our top two focuses this month that we can do. Is that we really want to get a letter to the editor sent in, and we really want to get a district drop-off done before the end of the month. I'll open it up to, anything else that you want to do, let me know, because there's no shortage of activity that we can do around this. I know ACS CAN has put it out there that if people want to have rallies or small rallies at congressional offices, they can do that. Other things, they've sent us some signs that can be printed off and things like that. So I would just say, the minimum is that I'd love everybody to do a letter and do a drop-by. And then if anybody has the time to do more than that or get other people to help, we welcome that, because we really need to show between now and the end of the month a lot of support for the provisions that are currently in law and why it's so important that they need to be kept. I can't reiterate how important that's going to be. So with that, I'm just going to open it up right now to any questions on the Affordable Care Act and what we're doing as far as taking action and anything, I guess. Anybody? Okay. And so just the, I pulled up our ask. I want to make sure that I have that clear. So our ask is not just to vote for pass a plan simultaneously, but we want them to vote against any repeal of the Affordable Care Act that doesn't include a simultaneous comprehensive replacement plan that is equal or better for cancer patients and survivors. So I think that's going to be important. I think the point we want to get across is that you can't just repeal the law and leave people hanging like I talked earlier. You've got to pass a replacement plan for people, and you do have to do it now so that people aren't worried about gaps in coverage or delayed enactment of things. That's going to be very important. So repeal, I'll put it this way. The plan was always repeal and replace. So just to vote to repeal it is not enough. They have to repeal and replace as was promised, and they need to do it now. Is that clear? I think. Probably. I don't hear any feedback, so I'm going to say it's clear. But so any questions on that before I move on to the last couple things I have? All right. A couple more things, and I'll wrap it up here. The last two things are more on the structure and reporting. So we're moving into this what they're calling the Ambassador Action Center, and so we have an Ambassador Action Center that now it kind of coincides with we had a relaunch of our website. So acscan.org has had a complete rehaul. So if you haven't gone on acscan.org lately, please go. They rehauled it and launched that in December. But with that, they've created this Ambassador Action Center, which we are currently loading up and preparing accounts for all of you. And so it kind of will replace the pillar system. And it'll probably work a little bit better than the pillar system because you'll be able to actually see kind of what you put in and what you've been doing. But we haven't completely rolled it out, and we will over the next month. And part of that is because we're kind of waiting to see and work any of the kinks out of the system before we kind of go full bore into it. But what's going to happen is that everybody's going to be is going to get a login, and it's all going to be set up for you. We're putting all your information in there, and you're going to be able to log in and put down your activity that you've done. And it's kind of going to keep track and assign points to different activities that are done. And it's going to kind of keep a leaderboard of where everybody is as far as their points that they've added up. So there will be a national leaderboard of points that everybody's put in and what everybody's doing. In addition to that, we're going to be able to also give accounts to ambassadors who are going to be able to sign up kind of under you as part of your congressional team. Which I'm going to plan on rolling out to ambassadors of those that might be interested to have them sign up on your teams. And they'll be able to put in their activity, and they'll kind of go towards the whole congressional district goal or point total too that they have. So it's kind of work on different levels. And they'll be able to track what they're doing too, and then we'll kind of be able to see everything that's being done at the congressional district level for each of the congressional districts. So that's going to be another aspect of it. So we're kind of going back. I know we haven't really functioned in the ACT team role, but I know we've made attempts to try to get our ambassadors a little bit more active with you as ACT leads. So we're kind of rolling back to that. And so with that, I also want you to know, as far as our volunteer structure goes, we're going to be spending a couple months here trying to identify deputy athletes for all the congressional districts, where we have people and where we feel we have people that might be good deputy athletes. And I think that is going to be good for us on multiple levels, which is obviously we can get some people to take on the deputy athlete role. One, we have people that are more engaged. We have more top-level volunteers to call on for different things, which is going to just enhance our advocacy reach. It'll also be good that we'll have that next person in line for athletes in case, in recent years we've had several people retire and not had anybody in the pipeline to take their place. We've had a couple of years where people haven't been able to go to D.C. and let us know, and then we kind of have to just find somebody to fill it. This will assure us that we have a good person in place that's been doing activity, that knows issues, to either fill in D.C. if somebody can't go, or it's ready to take that spot over in case somebody decides they need to retire or somebody moves out of the district. That happens too. And then also it'll just be somebody that you can communicate and work with to keep up some more continuous activity throughout the year. So if you're busy, I'll use Jay as an example. I know he's a CPA. I know he's very busy. I know the next 2 months for him is going to be a big time crunch. Having a deputy athlete there would be great because they could make a couple of, we could let them know it's a tough time for Jay. If they could be more active in March and April, it'll kind of help him out while he's busy at work. And then obviously when he's done and things slow down for him, he can get back to it. And maybe that's when they become, busier doing whatever they're doing. So I think that'll just help us get continuous coverage of the district throughout the year and just create more top-level volunteers for us. So I'll probably be communicating with each of you individually about people that we have identified. I'm not going to just go out and ask people probably to be deputy athletes without running it past you guys first. So I'll probably say, hey, here's a volunteer. They've really stepped up, or maybe they're brand new. They've been doing stuff. I really would like them, and just get your opinion on it before we move forward, and then start making kind of asks to those people if they'd like to take on that role as deputy athlete. And some of those people we have in mind right now, so I may be reaching out to you this month about it, and we'll be asking them to sign up on the Ambassador Action Center as the deputy athlete, which they will be able to do and select that role. Some of the other areas we don't quite have somebody identified yet. We'd like to, and then we have a couple of districts where we really don't have a lot of ambassadors as it is. So I'm probably gonna talk to you about expanding that team and trying to get more ambassadors on that team, and that more people that can help you out. The other thing that's kind of going to coincide with this is that we have 2 interns here at ACS CAN this winter/spring. And they're going to be helping me clean up our ambassador list that we have. We have a lot of ambassadors on our list. Some of them haven't been active for a while. Some are active. We're going to be calling through soon all of those ambassadors, giving them kind of all the options I just gave you. We need people to do drop-bys. We need people to do letters to editor. We need people to be ACS CAN leads at their relays, and try to get them more engaged and find out those that just don't have the time or want to be taken off the list so that we can remove them and have a good, reliable list of volunteers. So we're kind of going through a little structure cleanup, trying to advance some of our more active ambassadors into a deputy athlete role and kind of trying to maximize our grassroots ability. So that's all we have in store for you guys in the next couple of months here. Do we have any questions on any of that? I also would open it up that's pretty much everything I had for today, so I open up for any general comments on any of that, from deputy athletes to ACA to Ambassador Action Center, anything. Anyone? Everything sounds good? Wow. I heard Liz on the call, and I think Mary Ann said she was on the call too. And who else?
Yep, I'm excited. I'm excited for some things you got planned.
Okay, great. I'm not calling you out that you guys have to speak. I just want to make sure I remember who was on the call from earlier. But and I think there was one other that was on the call, but
Hey, Matt, it's
maybe
CJ.
that's CJ. Right. Welcome back, CJ. So,
It's cold.
not quite the Bahamas. All right. Well,
No.
I hope everything like that sounds great to everybody. CJ, I'm glad you're on. Congratulations for reaching the 4 pillars. We'll be sending your thing in the mail soon. And if anybody has any questions about anything, anytime, shoot me an email, give me a call. We'll help you provide that. I'll send the recording of this call out, but also the follow-up information with those one-pagers. Once again, I'd say we have 3 one-pagers now. I think I shared with you the key provisions I kind of went over. We have a fact sheet about that. We have one about insurance coverage right now and what the expansion of coverage has currently got us at right now as far as how many people. And then we also have a Michigan fact sheet. So I will send you that Michigan one that has some numbers specific to Michigan that'll be good for our visits. So with that, if there aren't any other questions, hearing none, I thank everybody for joining us, and I look forward to a lot of activity here in the next month. And please, 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 if you do anything, let me know what you did. If you can take pictures, post them to social media. We're looking to do all these things as we move forward through February, and I don't necessarily have to need to know. I just like to know when people are doing drop-offs and when they've done them, and get the feedback back of what you've heard at offices and how those drop-offs have gone. That would be great. So, thanks everybody for your time, and have a wonderful weekend.
Thank you, Matt.
Thanks, Matt.
Goodbye.